Hello, everyone, and a warm welcome to Spotlight on Scotland, the first Action for Pulmonary Fibrosis Patient and Carer Information Day to be held in Scotland. It's wonderful to see so many of you logged on already, and I know many others intend to watch the recording later. My name is Steve Jones. I'm the Chair of Trustees at Action for Pulmonary Fibrosis. I was an IPF, idiopathic pulmonary fibrosis patient for 8 years before very fortunately having a lung transplant 6 years ago. As most of you know, Action for Pulmonary Fibrosis is probably the leading UK charity working with pulmonary fibrosis patients and their families in the country. We support patients and carers through a network of support groups across the whole of the UK and a helpline and other support services we can provide. We campaign for improved treatment and care under the NHS. We seek to raise awareness of this devastating disease, and we commission and support research, which we hope will lead to us being able to stop pulmonary fibrosis, stop progression of the disease in the not too distant future, and eventually to find a cure. A key point about Action for Pulmonary Fibrosis is that we are a patient-driven charity. Everything we do is planned and implemented with patients and families. Also, all members of our Board of Trustees either have direct lived experience of the disease as patients or carers, or are leading healthcare professionals with lots of experience of working with pulmonary fibrosis patients. As a UK charity, we obviously work in all 4 nations, but in Scotland, we already support a network of patient support groups in Aberdeen, Fife and Tayside, Forth Valley and Glasgow. We represent pulmonary fibrosis patients in the Scottish Parliament and at the All-Party Lung Health Group, and we work with the Scottish Medicines Consortium to ensure patient voices are heard when it's deliberating about antifibrotic medicines for pulmonary fibrosis patients. Having mentioned the SMC, I'd like to warmly welcome Lindsay Lockhart, who's with us today. Lindsay recently retired as a patient involvement champion in SMC. She was a great help to us in pulmonary fibrosis in helping us navigate the system, and we're really glad that she can join us today. This event has been a long time coming. We had planned to run it in 2020 and intended it as a springboard for a rapid expansion in the number of support groups across Scotland. Unfortunately, COVID intervened and we had to postpone the event until today. But in the meantime, we've not been doing nothing. We've appointed Alison Stewart, I'm pleased to say, who we'll hear from in a moment, as our Scotland coordinator. And we've registered Action for Pulmonary Fibrosis as a charity in Scotland. At APF, we are determined to do all we can to improve the lives of people living with pulmonary fibrosis, that we're living with this devastating disease in Scotland. Turning now to the programme, we're delighted to welcome our expert speakers, including patient, carer, nurses, and Professor Tom Farden. We're grateful to all of them for selflessly giving up their time today. The timetable has been circulated ahead of time, but just to recap, I'm shortly going to hand over to Alison Stewart, the Scotland Support Coordinator for APF, and she will talk about what does APF look like in Scotland. We'll then hear a conversation between Don McPherson, a patient from Glasgow, and Maureen Ward, a carer from Fife, about living with pulmonary fibrosis. Then Professor Tom Farden from Tayside, who is the clinical lead for Respiratory Care Action Plan for Scotland, will give his keynote address. After he's finished, we'll have a short break, 10-minute comfort break, and that will be followed by 2 ILD specialist nurses, Michelle Duffy from the Highlands and Susan McCluskey from Glasgow, talking about a day in the life of an ILD nurse. Finally, we'll come together for a panel discussion, which I will moderate to answer your questions before finishing at 12:30. We want today to be as interactive as possible and would like to hear from you with your questions. Please put your questions in the Q&A box at the bottom of your screen. Do not put them in the chat. If they go in the chat, they won't be answered today. Please put them in the Q&A box, and please formulate anything you write there as a specific question, which I can then read out to one or more of the panel members later. That would help a great deal if you could do that. But please also, excuse me, please also be aware that we can't answer questions on specific aspects of your treatment, for your particular condition. So please don't put those into the questions. At Action for Pulmonary Fibrosis, we really understand how devastating and lonely it is to receive a diagnosis of pulmonary fibrosis. I can still remember the day when I was told the diagnosis over the phone in 2008. And that is why this event has been set up to bring not only vital information to the patient community and their families, but also a sense of connection and hope. We hope that today will be another step towards building a strong and effective pulmonary fibrosis community in Scotland, involving patients, carers, and healthcare professionals, and at the same time building a powerful patient voice for change. There's so much we need to do to improve the treatment and care of pulmonary fibrosis patients. Let's get together and let's champion that and achieve it. The day is going to be recorded, so if you need to take a break, you'll find a recording eventually on the APF website, probably in a couple of weeks' time. So with all of those messages over, it's my great pleasure now to welcome our host for the day and the person who is leading APF in Scotland. Alison, over to you.
Thank you so much for that introduction, Steve. And good morning to everyone, wherever you're joining us from today. So, as you can see from my first slide, I'm going to be talking about APF in Scotland. Steve told you he mentioned a wee bit about our beginnings. Our charity began in 2013, but I want to bring you a wee bit more up to date so you know what we're doing as an organisation now and how we provide support and advice for those lives that have been affected by pulmonary fibrosis. So, I joined APF in December 2021, so almost a year ago, and I cannot believe how quickly the time has gone, a year down the line. I started just a few weeks before Christmas, in fact, but that couple of weeks just before the Christmas break, it let me get started and learn all that I could about the charity and the work that it does across the United Kingdom. The main remit of my role as a Scotland coordinator is to develop and strengthen a network of support that aids quality of life for people living with pulmonary fibrosis throughout Scotland. So that all sounds a wee bit vague, doesn't it? What you want to know is how I, in my role, and we as a charity, do actually develop and strengthen that support. So when I started, first on my list was to learn all about pulmonary fibrosis, what it is, the different types, how it's diagnosed, how it's treated. I had heard of it before, so that was a start. In a previous role, I had managed a befriending service where we supported those living with respiratory conditions. So although it wasn't specific to pulmonary fibrosis, I did know about the condition. And every day really was a school day, and it continues to be that way. I'm always learning and I'm always listening to what people are telling me. And I'm going to put a plug in here for our very own APF website. I did much of my studying using the webinars that you'll find there, covering treatments, types of PF, pulmonary rehab, cough, research, caring for loved ones, to name but a few. So if you get a chance, do have a look. So I learned all about APF, how they started, why they started, and how they provided support across the UK for anyone who needed them. So now I have all this knowledge and I'm ready to start my networking. I learned very quickly how difficult it can be to get the right contacts in the right places and with the right clout. But perseverance allowed me to put together a list of contacts in respiratory teams across the Scottish NHS boards. Again, this is a work in progress, but I now have a great network of health professionals involved in the PF community across the country. They know all about me, about APF, and how together we can support the many patients and families that they come into contact with. Some of them are here today, I hope. And in fact, some are even going to be talking to you later on. So a thanks to them for all of their help and support. Peer support is such a fantastic but simple support system. And before I came on here today, I had a look at what its definition actually is, which is people with similar long-term conditions or health experiences supporting each other to better understand the condition and aid recovery or self-management. Across the UK, we have a number of PF support groups who received support from the APF to set up and continue to receive support from us. In Scotland, we have groups in Glasgow and Clyde, Forth Valley, Lanarkshire, Fife and Tayside. We're in the process of getting the Grampian group back up and running again as it stopped meeting during COVID. I'm also working with NHS Highland to get an online virtual group started up there. And Lothian too are interested in groups in the East, so I'll be working with them to support new groups in their area. But I have to be very honest and say that one of my biggest tasks over this first year with APF has been learning about these new technologies that we're all now taking for granted and have become a normal part of our everyday lives. I have been definitely transported from my comfort zone, well out of my comfort zone. But I think just by being here today and to have been involved with this event and organising it, then I must be doing something right. That's hoping you can all hear and see me. So I'm going to move on to what's happening right now in Scotland. So I'm going to start with groups. I mentioned the groups before and I make no apologies for talking about them again. The groups are an integral part of providing the support needed across the country. And although they run quite independently, it is my pleasure to support and advise them as they need. It's such an interesting time as we're coming into a new post-COVID restrictions era. Groups have so many more options now with virtual platforms like Zoom, so we can engage with and support so many more people whose lives have been impacted by PF. And as a coordinator, I am more than happy to support our groups to set up either face-to-face or virtually. Although I confess when it gets beyond my ken, I know of an organisation you may have heard of called AbilityNet, who have been fantastic at providing support to those of us not quite so genned up when it comes to IT. Then moving on to networking. Our Scotland network is growing and will continue to grow as APF's presence and support increases. We're working with some marvellous health professionals, and by listening to them, we can adapt our services to better meet the needs of those we support. We also work alongside other charities too, like the Pulmonary Fibrosis Trust and Asthma and Lung UK. So we know what's out there and we can learn about and we can tap into information and resources. Myself and Maureen, one of our support group leaders, whom you'll hear from later, sit on the cross-party group for lung health in Scotland, which Steve mentioned. And that's so we can better be informed about what's happening that will impact those living with PF and what the plans are for the future as we move on. In addition to the Scottish Government, Steve mentioned during his introduction how closely we work with the Scottish Medicines Consortium, ensuring that our input is there in the best interest of those that we support. So support. So what support do we actually provide across the country at APF? So as I've talked about, there's an existing network of peer support groups, and we're striving to assist more groups to set up, covering as much of Scotland as we can. Each month, we have a support group leaders meeting where all group leaders from around the UK are invited to attend. Here they can share ideas, concerns, and discuss the matters that are important to them. We also provide various speakers, both medical and some not so medical. And because it's Zoom, it really doesn't matter where you live. Our monthly carers group meets on Zoom too and is led by and attended by carers. Our telephone support line offers access to our team, including a specialist nurse who can provide information on pulmonary fibrosis, emotional and practical support, signposting to appropriate services, information about how APF can support, and social, practical and financial information. And if you'd like some one-to-one support, then we can match you up with a volunteer telephone befriender who can chat with you regularly. We've got a range of leaflets and other resources with advice and information, not to mention our amazing website, which is full of information and practical advice. And if you want to keep up to date with what's happening in the PF community across the UK, then you can sign up for our monthly e-newsletter and our quarterly Insider magazine. So quite a lot there involved with our support services. The next thing is direct referrals. We're working with the respiratory teams across the UK to implement a direct referral process. And this means that with the person's permission, a referral can be made directly by a healthcare professional to APF. And we can then make contact with that person and have a chat about how we can actually help and support. Because we want to be supporting people as early as we can in their journey and as early as possible after diagnosis. And we hope that this referral system will help us to do that. And where would we be without our fantastic fundraising team who work so hard to raise money for our charity, both organising events and supporting others to raise money for us? Vital funds help us to create new support groups, train telephone befrienders, and ensure access to a support line advisor and helpful information so that more people feel connected, supported, and able to face the many challenges that life with PF can bring. In Scotland, a Glasgow-based architect, Holmes Miller, has chosen us for their Charity of the Year. Sadly, they lost a colleague to PF and have selected us to fundraise for in 2022-23, so far raising £2,500. But not to be outdone, a group of respiratory nurses from Forth Valley Royal took part in the Kilt Walk in September and went on to raise £1,900 with a further £600 contribution from the Kilt Walk match giving. So a huge well done and thanks to everyone. And last but by no means least, research. APF's vision is to find a cure for pulmonary fibrosis. So research is very high on our agenda, and we are one of the major charities funding research in Europe. In fact, APF is at the forefront of an ambitious international research project just now. Remap ILD, you may or may not have heard of, and again, I would say have a look at our website, is a project that aims to find treatments faster for patients affected by pulmonary fibrosis. And it does this by revolutionising the way clinical trials are carried out in interstitial lung disease. APF directly funds high impact and high quality research, which has then the potential to contribute towards the discovery of an effective treatment or cure and speeds up the changes that can help our PF community to live well for longer. So do let us know if you'd like more information about APF's involvement in research or have a look at our research section of our website. So that is really a whistle-stop tour of what APF is up to in Scotland and beyond. But what are our plans for the future? So we want to continue to build on those networks and relationships that we are building across Scotland, but because we want to increase that awareness, we want people to know about pulmonary fibrosis, and we also want them to know about APF in Scotland and how we can help and support. We want to increase the number of support groups. We want to expand the reach that we have to support more people in PF and with PF in Scotland, and by increasing the support groups, that's exactly what we can do. Steve mentioned that we are a patient-led and very ambitious charity, and we want to look at different ways to develop our services to make sure that we're best supporting the people that we want to support. And the patient pathway, we want to become part of that patient pathway at the point of referral or as early as on as possible. We want to be there supporting people. And really, we want to be the go-to charity for anyone who is affected by pulmonary fibrosis. So I'm finished. You'll be glad to hear. If you have any questions or any thoughts about what you've heard so far, then if you please put them into the Q&A box. So not into the chat box, into the Q&A box, please. And as Steve mentioned, we'll be having a panel discussion later on in the session, and we'll hope to get to answer as many questions there as we possibly can. So thank you. So I think you've probably heard enough from me. But hopefully you know a bit more about what APF are up to in Scotland. We should have put a quiz at the end asking everybody about what they've learnt. But hopefully you know more about APF and what we're up to in Scotland. As we know, everyone's journey and experiences of living with pulmonary fibrosis is very different and very personal to them. Today, we are so pleased to have two people who are going to share their experiences with us. So I'd now like to introduce to you our next speakers this morning. They are Dawn McPherson and Maureen Ward, who are appearing on my screen now, as if by magic. So I'm hoping that you can see Dawn and Maureen too.
Good morning, Alison.
Good morning, and good morning to you too, Maureen. So Dawn is a retired head teacher. He was diagnosed with pulmonary fibrosis in 2018. And Maureen cared for her husband Les after he was diagnosed with familial IPF in 2012. So pulmonary fibrosis has impacted both their lives, and today they're going to talk very openly and honestly to us about this from their perspective of a patient and a carer. So can I ask you both, just if you're unmuted, great, just to sort of say hello to everyone and maybe tell us a wee bit about yourselves.
Good morning, my name is Don McPherson. I was a head teacher in a school in Falkirk for about 11 to 12 years. I had 35 years in education. I was diagnosed in 2018 with pulmonary fibrosis, something I'd never actually heard of before. I don't know if you want me to go into how I was diagnosed at this point, Alison. But
no, that's fine, Don. We'll
yeah.
come in. We'll come on to that. Just a wee bit about yourself and your background. And where are you talking to us from today, Don?
I'm talking from Bishop Briggs in north of Glasgow, East Barton, where I've been living now for 17 years. I have got 2 children, both of which are just about grown up. One is actually a student nurse as we speak. Another one's a teacher, and my wife's a teacher who's going to be retiring next year also. And apart from that, my hobbies include wood carving, but my major hobby is again dinghy sailing, which I do at a club. Dinghy sailing, yeah. Wow. Which I do at a club down in a place called Bardowie near Bearsden. It's a Clyde Cruising Club dinghy section.
Oh, right. Okay. Excellent. That's great. Thank you, Don. Because I think when we do these Zoom calls and we're not all together, it's nice to know where people are calling from. It's been a Eurovision Song Contest. Where are you calling from? So, Don, you're calling us from Bishop Briggs today. Brilliant.
No, yeah.
No, well, I hope not. Maureen, where are you? If you can tell us a wee bit about yourself and where you're speaking to us from today.
Hi there. I live in Fife and I'm retired now, but I had a hotel in the Highlands for 18 years. I met Les in 1994 when he came to my hotel for a holiday. It was a second marriage for both of us. His wife died of cancer a couple of years previously, and my husband had run off with another woman.
Okay, well, that has been very honest. Thank you for your honesty there, Maureen. But that's great. Thank you. It's nice to get a wee bit of background, just so as we know a wee bit more about you before we move on. So we know that we've got quite a number of guests with us today. And we know that many will have been recently diagnosed with pulmonary fibrosis. Some may have been living with pulmonary fibrosis for some time. And as I said, I'm sure everyone here today will have had a different experience of that. So before today, we had a wee chat about what we thought would be good topics for us to talk about today in this sort of conversational piece and what would be beneficial to those who are joining us. So we're going to start today by talking a bit about that time at which you mentioned, Dawn, about when you received that diagnosis of pulmonary fibrosis. So Maureen, if I can maybe come to you first, if that's okay, and ask if you can tell us a bit about what led to that diagnosis for Les and how you felt when you were first told that.
Yeah, Les was becoming increasingly breathless, and after a CT scan, he was told he had IPF. We were given an appointment in 6 months' time when we went to Nine Wells Hospital. We left the clinic without seeing anyone else or handed any literature. So neither of us had heard of IPF before. So when I got home, I Googled it, and then I sat in front of the screen sobbing.
Yeah, absolutely. So you didn't feel you had lots of information or support at that time, and sadly so many people kind of, I think sometimes can maybe relate to that and maybe feel the same way. And then what happens is Dr. Google comes on the scene and people start to look at that and find all sorts of things. Absolutely. What about yourself, Dawn? What was your experience when you were first diagnosed and how that impacted on you?
Oh, well, in 2018, it sort of came to a head because I had been diagnosed with asthma when I was about 14, and I just assumed that my asthma was getting worse. I was starting to get much more breathless. I was coughing a lot, finding it difficult to get around school in time without having to sit down even. And my wife persuaded me to go to my GP, who sent me for an X-ray. And actually, I came in thinking, oh, when I was called back to the GP, expecting to hear maybe I had some lung cancer or something. She said, no, you've got pulmonary fibrosis, and there are still people kicking about here in their 80s with it, and here's a printout sheet. The printout sheet basically said I had 2 to 5 years to live, and that was what I was left with. And a bit like Maureen, it was all a bit of almost a panic, almost a shock to the system, having never heard of this condition, to now know that I had quite a serious illness. And it wasn't until I went to the pulmonary department at the Glasgow Royal Infirmary that things started to change in that, and the department there had been fantastic. And I saw a consultant, and then was sent for some lung rehabilitation, and that's when it made a huge difference. I also met another patient there who's become a friend called Robert, and we were actually almost a support group for ourselves, because at that time we weren't involved in any support group. So, and since then my disease has progressed to the point where I was diagnosed with prescribed oxygen in June this year, and about 4 weeks ago I started on antifibrotic drugs, and that's where I am now.
That's where you are now. And I think, so what I'm kind of hearing from both you and Dawn, Maureen, is you got that diagnosis was given, and then you got, well, Maureen, you felt you didn't get much information at all. Dawn, you were given information, but that minimal amount of information scared you, and then you went to look for more information. So I think it's all about getting the right amount of information at the right time, then, really, isn't it, that helps at that point. And as you said, Dawn, you'd never heard of pulmonary fibrosis. It was a bolt from the blue. You'd expected something else. You heard pulmonary fibrosis and you thought, don't know what it is, don't know. So again, it's all about raising awareness, isn't it, so people know a bit more about the condition and have heard of it before. So, okay, so you got this diagnosis, you did a bit of homework yourself to find out. Did you look at any services that were maybe out there that would help to support you, Maureen? Did you access anything? Did you look at any kind of, obviously, maybe through your hospital, so either through your hospital or externally, did you find any services that were helpful to you?
No, not at first. It was 2012, so APF was in its infancy. Les was in denial and just wanted to carry on life as normal, which is quite common. So really, not for a few years until we started our own support group. Yeah.
So really nothing, you didn't feel like, and as a carer, did you go to any carers organisations or anything like that?
No,
did you? No.
Absolutely nothing until Les really started to suffer from the disease. Then by starting our own support group and then finding out about APF and realising the benefits of joining a larger information, we got lots of information, and yeah, it's been really helpful.
Good. And what about you, Dawn? Did you access any services that were out there to help support you at all? So, I'm thinking of like citizen advice bureaus, anything to do with benefits, anything to do with more information about the condition itself. Did you go to any other organisations to get that support?
Well, within my work, I was sent to occupational therapy, or occupational health, sorry, who were really just dealing with how I was coping with my job, which was getting more and more difficult because being a primary head teacher in particular, you have to do a lot of moving about the place. And actually, I was starting to discover I couldn't do my job anymore. So I was also starting to go through the process of coming and realising that I was going to have to give up my job because I wasn't being able to do it effectively or be able to keep my members of staff safe and so forth. It's a very proactive job, so to say. I was then in 2019 sent for the pulmonary rehabilitation, which was held at the Royal Infirmary, which consisted of a half-hour lesson and then actual pulmonary rehabilitation classes to help improve the circulation stuff. And that was where things probably started to turn around. In that information we were given by people like Susan McCluskey, a specialist respiratory nurse, the physiotherapist, the special respiratory physiotherapist, and from consultants. actually started to fill in and give me the information about what it actually was I was suffering from, the fact there was more than one version of it. And that continued for the rest of that year, where I then went through retirement. And then beginning of 2020, something else happened, which stopped any further interaction with people for, as we all know, when COVID arrived. And that actually put probably a halt to everything in many ways. So I was left almost for 18 months with no progress from there in any support or whatever.
Yeah, and I think COVID caused all sorts of problems, but at that particular time too, and it sort of called a halt to things like you've mentioned pulmonary rehab, which is so important. And a lot of people maybe joining us today will know about pulmonary rehab, or maybe have taken part in it and how important it was. So it's really great that you were able to access that. Sadly, some people can't access it quite as easily. And the benefit, as you said, at that point, it helped you turn things around. You felt things were turning around at that time. Yeah.
Yeah,
So,
I'm getting much more information. Yeah.
Good, excellent. And that's it. And I think people forget pulmonary rehab isn't just about exercises. Pulmonary rehab is about education and about learning more about the condition that you're living with too. And I think it's important to remember that too. So my next question was going to be, what other things did you do to help you deal with it? So you've mentioned pulmonary rehab as well as something, Dawn. What about family members? Did family understand? Did you feel you had to explain to them about what pulmonary fibrosis was? Did you feel that family sort of were there to help and support you, Maureen? Did that make a difference to you as a carer?
Yes, it did. But I had a very young grandson, and Les had a daughter living down in Sussex. So we found, excuse me, we found the most benefit from talking to other people, other members in the support group, and then all the information we were getting from APF. And you just feel supported by other people that have got the same lived experience, and also a wealth of information out there. Yeah.
Yeah, absolutely. So, and you've both mentioned support groups, which is fantastic. So we'll come in and move on to maybe talking about the support groups now, and how you felt that did support you. I mentioned a wee bit about peer support, and when I found that definition about peer support, it's such a simple thing, isn't it? And it's about, as you see, Maureen, it's about talking to other people who actually understand where you're coming from, because they're living with it too, whether that be as a carer or as someone with a condition. So yeah, so if we move on to talking about support groups a wee bit. So Dawn, you talked about the support group that you joined. You'd already met somebody, you said, was it Robert?
Yes, Robert, yes.
And so I know that you both attend the Glasgow group. So do you want to tell us a wee bit more about how you got involved in the group and the benefits that you feel you get from that?
Well, that came about earlier this year, as we're all coming out of the last sort of almost bout of COVID, shall we say. I was prescribed Oxygen, and at the same time, I was invited to join the support group run by yourself and by Susan McCluskey, which, and it's at the same time when I was starting the Oxygen, where I was already full at web because I was having to go into Oxygen. Being able to speak to other people who have been using Oxygen for a while, who have been living with pulmonary fibrosis for a lot longer than me, suddenly gave you a bit of hope. It started to, you were able to ask people questions about, okay, what's the best way to use this? And actually, I feel in many ways, my life actually started to become much better at that point, much brighter. I was much more positive about things, and including becoming involved like this, much more involved in my sailing club and so forth. And it all stemmed from the same time when I was able to speak to other people and get the support I think I needed probably long before that, but wasn't able to get. And just asking people questions like, okay, my Oxygen here, I still struggle to get up the stairs. And someone said, well, just turn it up for a wee bit. You know, it sounds very simple, but without actually having people there who have been living with it for many years, it's not something that most people would think about.
Yeah.
You know, things like that, but also being able to support other people. You know, since we've been on the part of this group, other people have come on who have just been diagnosed with it, and you're able to say to them about things like the pulmonary rehab and so forth, because the resources and the support do vary a wee bit depending on which part of Glasgow, which part of Scotland you're in. So yeah,
Yeah, absolutely. It does. You're right. It does vary sort of from place to place what support's out there, but the support groups certainly seem to provide that. And it is about that peer support, isn't it? It's about chatting to each other. It's about sharing ideas and thoughts and questions and worries and concerns and yeah, everything as well. But it's great that you found that. You really found that support, and that you mentioned hope, that you got that hope from it as you moved on. So that's really great. Thanks for that, Dawn. Maureen, can I ask you, because your experience of the support groups a wee bit different from Dawn, because you were instrumental in getting support groups started and up and running. So can you tell us a wee bit about that?
Right, we found it very difficult first. We don't have any referrals from any of those 2 hospitals with my support group, because we have Fife and Tayside as one group. So we don't have any referrals. So it's just a matter of advertising, APF helping us put the adverts on your website for contacts for support groups. Yeah, and it's just helping the people, the practical things. You know, there's no signposting, but by joining the support group, you can give advice to patients about organisations, Citizens Advice and Carers UK. They will help you fill in the forms for things like attendance allowance and the blue badge. And however competent you feel you are, don't fill them in yourself, because these organisations know the buzzwords. They will take you through the forms, and you've got a much bigger chance of success. And you deserve those allowances, because there are things you can't do yourself that eventually you will have to pay other people from outside to do. Occupational therapists, they can help provide equipment to help make your home more accessible, and many of our members don't have any of this information, and it's a big worry to them about what's going to happen in the future. How can they stay in their own home?
Yeah, absolutely. And I think people forget that too. At groups, you can get a wealth of information from attending the groups too. You know, you find out about things like that, like you're talking about occupational therapy, but pulmonary rehab. You know, people don't always know about all these things, and we can't expect, you know, we just can't assume that people will just automatically know. So it's great to be able to have that. So that's great. And I can't stress enough, you're right, Maureen, with these claim forms for benefits, there's lots of benefits out there that people are entitled to, they might not know about. Find out, come to us if you need more information. But yeah, don't think about tackling these forms yourselves unless you're really confident, because you really do have to be putting the right things in the right places to try and increase your chances of getting these benefits. So yeah, absolutely. That's great. Thank you very much. That's great. It's great to hear the 2 perspectives about the support groups. So what I would say, Maureen, is you having cared for your husband, what advice would you give to other carers? It's so important that carers look after themselves. I think sometimes carers forget to do that or struggle to do that. So we know it's important to look after yourself. How did you do that yourself, and what advice would you give to other carers, Maureen?
Well, as you say, it's really important to look after your own health. You can't look after somebody else if you're not well. But I was very lucky, because we have a good GP practice in the village, and often the GP would stick his head in the door and speak to Les and say, "Are you all right?" But he also used to ask me, "How are you coping?" Not many people recognise that, you know, all the attention is on the patient when the loved one might be struggling. So I sort of organised well in advance and got lots of information from APF and from other members, and we were able to set up and be well organised in good time, which was great.
Yeah, that's good. Yeah, it is. You've really got to look after yourself, absolutely. And think it's nice that the GP did think about you and say, as you say, it's very unusual for somebody to say, "How are you?" Because you do have to think about how you are too. Dawn, because I know it's your wife you mentioned before.
Yes.
So would you agree with what Maureen's saying? Obviously, how important it is to look after yourself when you're a carer. And does your wife make sure she looks after herself?
Well, do you know, it was actually when I spoke to Maureen when we were preparing for this programme and stuff, I became much more aware too of it from the carer's perspective, because I think when you're the patient, it's very easy to become blinkered and not think about, you know, the support you have from your family and so forth. So yes, it's very important. My wife is fully aware exactly what pulmonary fibrosis is, and the sort of things I'm going through, at the same time trying to keep she's still trying to keep do a job of work and keep herself positive, because it's a big change for the whole family. You know, the children getting used to the fact that quite possibly I won't see any grandchildren or whatever, and things like that. It's a hard thing to come to terms with. But at the same time, being positive about things when you can be, and using the support when it's there.
Yep.
One thing that Maureen said there about the support for filling out documents and so forth, it was actually one of the respiratory physiotherapists from the team in Glasgow here pointed me to the Citizens Advice, who have an office based in one of the local hospitals, who helped me fill out and do the forms for getting support and so forth. And that was a great help. And exactly what Maureen was saying there, the sort of right things to say, the right buzzwords, as it were, or what have you.
Yeah.
You become much better at that.
Yeah.
And pass that information on to other people.
Yeah,
but
absolutely.
Yeah, it's very important. I think about my carer as well.
Yeah, absolutely. And I think we do. We're all guilty of taking people for granted, aren't we? And I think we have to think about those who look after us. And if we are carers, think about ourselves. So thank you for that. So we're quite close to coming to the end. What I would ask you is, going forward, what would your hopes for the future be? So as a patient, Dawn, what would your hopes be for the future?
Well, you talked about research and so forth. That is where the big hope for me for the future is, slowing down the disease, starting the pulmonary, or the antifibrotic drugs is a step in that way. Trying to keep myself as well as possible coming up to the winter, thinking about what kind of weather I go out on and so forth, just the risk assessing and what have. But like I said, the research element, where we might be in 5 years' time, all being well, still here, touch wood, and having hope for that future.
Yeah, brilliant. Thank you. And Maureen, what would your hopes be for the future from a carer's perspective?
I would like to see automatic referral for psychological counselling a couple of weeks after diagnosis, and then again oxygen is a huge shock for people. As Don said, more research, and also opportunities in Scotland for people to take part in clinical trials. There's not a lot out there for us in Scotland. And when you see what's available in the rest of the UK, in the major hospitals, we miss out. My husband took part in a clinical trial, and it's very rewarding to know that even if you're not helping yourself, you might be helping a future generation, especially if you have familial IPF, because we don't know if Les's daughter is at risk or his grandson, and find something to halt this terrible disease.
Yeah, definitely. Yeah, that would definitely be hopes for the future. So before we finish up, if you could give us all one piece of advice to take away with us today, what would that be? Dawn, what would your piece of advice be?
Speak to other people who have got the same illness, learn from them, learn to teach other people as well, and keep positive. Maureen said there about the oxygen, big shock. I've now come to realise, after having it for several months, it's been a very positive thing for me. So treatment might seem as a shock, but it's for a reason, and it has improved my quality of life. Brilliant.
Thank you. And Maureen, what would your one piece of advice to take away be today?
That's a difficult question. Lots and lots of things I can think of, but yeah, the same as Don, stay positive and get support.
Absolutely, that's great. I think we could probably talk all day about this. We could go on forever. We've only got 25 minutes for this lot to talk about because we're restricted for time today. But thank you so much for that, and I hope everybody has learned something from what you talked to us about today, and obviously maybe sort of understand where you're coming from as well, and sort of maybe see themselves in some of the things that you've mentioned too. So thank you very much for that today. So thanks.
Thank you.
Thank you. So thanks to Dawn and Maureen for that very personal insight into their lives and for their honesty. It can be really hard to share personal insights into your lives, so thank you for that. As I said, everyone here today will have a different experience, but thanks again to them for sharing their experiences with us. And I think if I could take away 3 positives from what Dawn and Maureen have told us today, that would be First of all, the benefits that they found in peer support, the chance to talk and share with others that understand your problems and concerns, but also your joys and achievements. And I think, as Dawn just said there too, don't be afraid to ask for help, although sometimes it can be difficult to see. Help and support are there. And finally, both Dawn and Maureen mentioned hope. Hope that things are changing, things are moving forward. Research was talked about, it is being done, and we hope for and that we're working towards finding a cure for pulmonary fibrosis. So again, thanks so much to Dawn and Maureen. So I am now delighted to introduce our keynote speaker for today, Professor Tom Fardon. Professor Fardon is a consultant physician in respiratory and general internal medicine at NHS Tayside, honorary professor with the University of Dundee, and associate postgraduate dean for the East of Scotland region of the Scottish Deanery. His national roles include chair of the National Advisory Group for Respiratory Medicine, and he was the clinical lead for the Respiratory Care Action Plan for Scotland and is now the lead clinician for the Scottish Respiratory Advisory Committee, and is the Respiratory Speciality Delivery Group lead within the Centre for Sustainable Delivery. So, Professor Fardon, it is now over to you. Thank you so much.
Thanks very much indeed, Alison. Now, I'm currently sat in, I'm in London at the British Thoracic Society Winter Conference. So this is my hotel room. So I apologise for if it's a bit echoey and for presenting to you my hotel room, but this is the place I could find that I had a chance to be able to speak to you. So thank you very much for inviting me along. My brief today was to speak to you about the national, and by national I mean Scottish, plans for IPF, to talk about the work that has been done so far in the Respiratory Care Action Plan and how we're moving forward with the implementation of that work, and how we are trying to pull together the expertise which is undoubtedly in place in Scotland in terms of the consultants, the doctors, specialist nurses, physiotherapists, speech language therapists, etc., that really are trying very hard to improve the lot for people with pulmonary fibrosis. So how did we get where we are today? So I'm just going to manipulate things around my screen a bit so I can see what I'm looking at. So in 2018, I was going to say elected, but I think I stood still when everyone else took one step back. So I became the lead for the National Advisory Group for Respiratory Medicine, and my predecessor Ian Small had worked very hard to try to set up some standards of care for all of respiratory medicine, so that our managed clinical networks could formulate their job plans in line with a national document. This had, despite Ian's best efforts, had come to nothing, mainly because of the lack of engagement with Scottish Government, or by Scottish Government, I should say. So in 2018, one of the first things we did was to approach Scottish Government and ask them to work with us to generate a set of some standards of care. Now, they were actually very interested at that point, but they didn't want a set of standards of care. What they wanted was an action plan. They wanted to generate an action plan for respiratory care for the next 5 years. Now, you may or may not be aware that NHS England and Wales, a couple of years ago, they published their 10-year plan, which includes a big chunk of stuff about respiratory medicine. So what we've gone for, what the Scottish Government went for, is a narrowed down focus of just respiratory medicine, but for the next 5 years. So I led that work starting in 2018. And one of the things I realized very quickly is that government work moves at a glacial pace. I had this naive idea that I'd be able to knock this out within a year and we'd be already and done, and now we'd be 3/4 of the way through it. But these things take a lot of time, huge amount of time. And one of the things I felt was very important was to get expert panels together to be able to thrash out what's the state of the nation, as it were. What was the current state of the service for different bits of respiratory medicine? What are the current needs? What are the desires? What is aspirational? But also bearing in mind the CMO's vision for realistic medicine for Scotland as our overarching principle. So where do we fit between where we are now, what is aspirational medicine, and what is realistic medicine? And those panels, we met in 2019. It was excellent representation. I'll talk about it in a second. And then in 2020, the plague hit. So we were massively slowed by COVID as I went from writing this document to being doing 12-hour night shifts in our COVID assessment unit, literally overnight. Despite that, we did push through with it, and it was published in, I think, March or April of 2021. And then we had this third wave of COVID and things slowed up again. But the implementation group for the Respiratory Care Action Plan is called the terrible acronym SRAC, which is the Scottish Respiratory Advisory Committee. So that is a group chaired by Professor Adam Hill, and I'm the lead clinician for that. And we have representation from various groups sat on that group, including patient representation from the Patient Alliance, to push forward the promises that were made in the Respiratory Care Action Plan. That group, the SRAC, has met a number of times in 21-22, and we've now have subgroups and action plans for a number of different areas. So why does IPF fit into that? IPF is not my area of particular clinical expertise. That's not to say I don't know anything about it, but I wouldn't hold myself up as being an ILD or IPF specialist. So it was clearly important to speak to those IPF specialists. And we had representation from not every health board, there's 14 regional health boards, but we had them a representation from north, south, east, west, primary care, secondary care, multidisciplinary involvement. And one of the first questions we had to ask was, well, is IPF or ILD indeed a big enough thing for us to put into the Respiratory Care Action Plan? Because you can't put everything in there. Some things are very rare. And I don't know why that slide keeps moving on by itself. It shouldn't do. We'll try and pause on there. So that one of the first questions I asked of the IPF specialists is, IPF is very rare. And chest physicians, we're very aware of it, and we see plenty of it. But actually, in the population basis, it's very rare. So is that enough, or should we include all of the interstitial lung diseases and clump them all together and have that as our focus? And clearly, there is a big difference between idiopathic pulmonary fibrosis and other ILDs, such as sarcoidosis, hypersensitivity pneumonitis, rheumatoid or other connective tissue disorder associated interstitial lung diseases. And some of those already have other frameworks. And they also have other treatment pathways. So if you have a connective tissue disorder associated ILD, the treatment effectively is treat the connective tissue disorder, and that sits with the rheumatologist. If you have a hypersensitivity pneumonitis, that may sit with an airways disease person, but IPF is very much our own disease. And actually, there's a big burden of care. There's a big there's gaps in the service there, and so that's what we decided to focus on. So the questions we asked at that clinical group, the specialty group, is what structures already exist. What are the current needs? What are the priorities across Scotland? What do the patients say? So what do people who have IPF, or what do they say? What do the relatives and carers of people who have IPF say? What is important to people, and what should our priorities be? So that was one of the most interesting meetings that I organised and sat in on. We did that meeting, I think, in Stirling. I think it might even be the first meeting we did. And was very enlightening, because I work in Tayside, and I know what service we have, and I appreciate there are gaps in it, but we have some interested clinicians, we have specialist nurses with an interest with a specific role in IPF, we have palliative care team, we have, we're pretty well set up, and to discover that other health boards were struggling to provide that kind of service, or had a complete absence of that service, was very enlightening. So there really is a big variation across Scotland. So we focused on IPF. I think I've mentioned this already, because there are lots and lots of different interstitial lung disease, and IPF is the most common of them. And critically, there are new treatments available in the form of nintedanib and pirfenidone, and we know that they're underutilized. we can collect that data. Because of the prescribing is all done in secondary care, we know how many prescriptions of nintedanib and pirfenidone are being given out and when they're being given out by down to the hospital level, hospital pharmacy level. And although we don't know the denominator very well, we're not sure how many people across Scotland actually have IPF. We know how many people are diagnosed with it, and we also know the population. So if we say that 1% of the population have IPF, we can make a decent estimate. So we know that there's a big variation depending on where you live, as whether you've got access to getting nintedanib, pirfenidone, as well as getting a difference in access to specialist care. And as I said, many other ILDs are often associated with other syndromes, and the treatment is often guided by those treating those syndromes and by those specialists. So what do the patients say? What do we do if we want to know about what the patients say? We go to the patients and we go to third sector. We went to the British Lung Foundation, and then this is the APF document saying, what do people and carers, those with the lived experience, feel is really important? And this is consistent across any survey that we've looked at in IPF. Delay to diagnosis. So on the left-hand side there, you can say 35% of patients are misdiagnosed and only 46% are diagnosed correctly within 6 months of visiting their GP. So some of that is because it's complex. Sometimes it's because it's very rare. There are other reasons why those delays happen, but to my mind, that's an unacceptable delay when it's something which, if you present in your 60s and you're very breathless and you've got crackles in your chest and your oxygen levels are low, then that's not a we'll see how that goes and bring you back in 6 months. That's something that's done. And the diagnostic test is a CT scan, and getting access to that is not that difficult. One health board in Scotland has direct access to CT scanning from primary care. It's my health board in Tayside. Others are looking at it, but we've been doing it for 10 years. So we have very rapid access to diagnostic tests. It is possible, you can do it. Only 53% of people have completed a course of pulmonary rehab classes, and only 14% had specific for IPF needs. Pulmonary rehab is one of our one of our strands in SRAC and RCAPS, because pulmonary rehab has been proven to be massively beneficial in COPD. It's one of the standards of care. It's one of the few things that makes a difference to mortality and outcome, yet it's very patchy across the whole country. And even within my own health board, we have in Angus at the moment, there is, because of staff shortages, there is no access to pulmonary rehab at the moment, which is embarrassing, if nothing else, but really is something we need to be pushing, is that's just not acceptable that there's no pulmonary rehab available. It should be available for everybody at the point of diagnosis if you have a respiratory illness. Specialist nursing, a third of patients lack access to a specialist nurse. I'm surprised it's that low, to be honest. And in terms of specialist nurse, you have to ask, well, is that a respiratory specialist nurse, or is that a specific IPF specialist nurse? Is that a palliative nurse, oxygen nurse? We don't dig into that, but certainly there's a large chunk of the boards around that don't have specific IPF specialist nurses. The training for that role is challenging. There is a master's degree module in IPF. I think at the time we wrote this up, only 3 nurses in Scotland had done it. More have done it now, but you've got the challenges there in terms of workforce planning are finding senior nurses who are experienced and want to do it, getting the funding for them to be able to go and do the training, do the module for the masters, and then funding for them to be specifically an IPF nurse when there's a huge demand for other more common diseases like COPD, asthma, cancer. No less important, but in terms of numbers, the people are having to make very difficult decisions. The next thing on this list is oxygen therapy. I caught the tail end of the last couple of speakers, and the oxygen therapy was mentioned a number of times. What we hear is that patients are not being assessed for oxygen therapy, which to me is really disappointing. This is a really easy thing to do. You see somebody, GP, nurse, whoever it is in the community, pharmacist even, you measure your SATs are less than 92% on 2 separate occasions, you get assessed for oxygen. And our oxygen assessment system in Tayside is run by our specialist nurses. and there is consultant input if required. We optimize management and give oxygen if required, and the service is very, very good. So the question is, how is it not happening? Is it that that not everywhere has the same process within secondary care, or are people not being referred up soon enough? And that's something we really need to sort out. And then support. Only 63% of people feel well supported in managing their IPF, a drop from 76% in 2015. Again, I'm surprised it's that high, to be honest. I think we hear from a lot of people feel that they are given a diagnosis and then don't have any support, particularly in that initial period. I think one of the previous speakers said this, of where is that first 2 weeks of being told you've got IPF, and you leave the clinic room and you go home, and then you have to tell your family that you've got IPF, and they ask you lots of questions, and you say, to be honest, the doctor told me I've got pulmonary fibrosis, and that it's an incurable, irreversible disease. And after that, I wasn't really listening anymore. And we recognize that. So how can we provide better support to you and your families? And once the diagnosis is made, it's really very important. So what already exists? There is a very active Scottish ILD group, which I think George Chalmers in Glasgow is the current chair of. If you're not the chair, he was. And George is very active in this area. He was on our specialist group back in 2019 and has continued to be instrumental in how we work in IPF. So that national interest group has been going for quite some time. It's not a formal government group. It's an interest group run by interested clinicians. And that is a problem, I think, that it's not formalized. I'm very keen that we have a lead clinician, a lead IPF clinician for Scotland, and that is funded, recognised, and there's some succession planning so that somebody can be responsible for taking forward IPF specifically. Now, most hospitals will have a clinic for where people were seen with IPF. Now, some health boards may centralise that. So if you're near to a very small hospital, you may be sent to a bigger hospital just down the road. But most hospitals will have some IPF type clinic, but that is not standardised at all. We have no register of IPF specialist doctors, so I can't tell you how many consultants there are in Scotland who are sort of card-carrying IPF specialists. I just don't know. And I can't even tell you how many of our doctors would declare themselves as being interested in IPF. So when you go to see somebody, I've got no way of reassuring you that you're seeing someone who's expert in what you're seeing. And now that's not isolated to just IPF. That's the same for anything else, asthma, COPD, many things. But I think that's a problem, and I think that in a disease which has limited options, if you Google it, you get lots of scary stories. I think the reassurance of seeing somebody who is recognised as an expert in the area, I think it is really important. We similarly have no register of IPF nurses. I can find out how many specialist nurses there are registered at different places, but I can't tell you if they're specifically IPF nurses. They may be doing IPF work, but I couldn't tell you if they've done an IPF diploma, for example. And a really important thing is multidisciplinary team working. We do this in everything. It's very, very rare, to the point of extinction, I would say, that a single-handed clinician is now is making the single-handed decisions about patients' care, particularly in IPF. It's a group of doctors, nurses, radiologists, physiotherapists often, and pathologists working together to make a decision in that multidisciplinary team. And we don't have a register of how many MDTs there are or who's in them. This is one of the things that when we met at the Scottish Respiratory Access Advisory Committee just a few weeks ago, we ratified that we would prioritise this as a thing that we need to do. So through the Centre for Sustainable Delivery, we're going to pull together a short-life working group to just look at this exact thing: is how many people across the country do we recognise as being IPF specialists, and do they have an MDT, and who goes to it? As I said, we have very good prescribing data for these advanced therapies. because they're regulated. So I know I can pull data pretty quickly, like by this afternoon, to tell you how many people had pirfenidone last month in every health board. We have some good third sector support, this group APF particularly, but also the British Lung Foundation, now called Asthma and Lung UK, and Chest Heart Stroke Scotland, very supportive. And what was highlighted at the time is very limited palliative care linkage. So getting from a respiratory clinic into a palliative care clinic or palliative care environment for symptom control, and then ultimately end-of-life care if and when required, was very challenging for a lot of people. We heard that from patients and from healthcare professionals. That's the wrong button, try again. So what we need then, and this is one of the things we're trying to push on with, is getting data at a health board level. We're trying to push consultants with a specialist interest, trying to get funding for them to go and do their diplomas. We want to know what clinics are happening. We want to know where those MDTs are. We need to know which health boards across the country have direct access to CT scanning from primary care. If people are waiting a long time to get their diagnosis, 6 months or more, then why is that? And how can we improve education in primary care, or just public awareness that IPF is a thing? Excuse me. And then with standardization of pathways. So how do we standardize that if someone is eligible for an advanced pathway, advanced treatment, how do they get it? How do we make sure that it doesn't matter whether you're in Glasgow or Dundee or Applecross or Melrose, you're going to get into a pathway that means that you will see the right person at the right time and get access to the right drugs. And that's the same for oxygen and for palliative care as well. These priorities, I've said that already. So what we've done about this already, the Centre for Sustainable Delivery, we funded an ILD palliative care project in Tayside. Andrew Gowdy is the ILD specialist and Claire Douglas is a palliative care doctor. They worked for a couple of years to be able to do a clinic once a week for palliative care input towards the end of the ILD IPF journey. We got fantastic patient satisfaction scores. We reduced our number of admissions, and we had increased use of hospice care, increased use of at-home care, and we really like to expand this out to other health boards, and we're working with health board leadership to do that. I mentioned getting access to CT scanning. This is a really, really important piece of work that we're doing, not just for IPF, but CT scanning is the diagnostic tool for bronchiectasis as well, and cancer. So this is a piece of work that we're pulling together respiratory medicine, primary care and radiology to try to expand so that if a GP feels that a CT scan is required and is the right test, and that can be done without having to jump through 15 different hoops. And perhaps the most complex work stream that we're working with is data. This is a really complex area of trying to pull together many different computerized systems to talk to each other. But we're really at the bottom level here. We're starting on the first step of what data do we need? How do we need to collect it? Who needs access to it? And how can that data that we collect improve outcomes? So data is really, really important, but we're at the start of a very long journey. And I think the last thing I mentioned over here is pulmonary rehab. This was brought up by, I think there was a question actually as I joined the meeting here in the Q&A of, how do you get access to pulmonary rehab? The problems that we face across Scotland and the UK are sustainability and staffing levels, getting enough physiotherapists of sufficient experience and training, or nurses, and then the infrastructure in terms of the building. It's just physically, where do you actually do this? So virtual approaches are really, really helpful, and getting an app for your phone or doing it over Zoom are really clearly very, very helpful. And there is evidence to show that they work. And we really need to push health and social care partnerships and regional health boards, say, where is your provision of pulmonary rehab? And make sure it's not just for COPD. We are trying to develop a patient's charter for pulmonary rehab so that you as patients and carers can say, this is what the expectation is in terms of pulmonary rehab. And we're tying that in with the Scottish Government Rehabilitation Framework, which came out post-COVID. I mentioned already that we have set up an IPF short life working group. and Josh Chalmers and I are leading on that to try to focus on IPF through the Centre for Sustainable Delivery, so we can really push on with improving those pathways, particularly primary care, access to imaging, into secondary care, see a specialist, be reassured you are seeing a specialist, or there's a discussion with a specialist and a specialist MDT thereafter. So those are the pathways we're working on at the moment through this Centre for Sustainable Delivery that I've mentioned already. So very happy to take any questions if you have any. He says, messing around with the screen. I've overrun very slightly, I apologise, but very happy to take any questions. Very happy to answer them in the chat if that is helpful to you.
That is great. Thank you so much to Professor Fardon. And you did overrun a wee bit, but it was far too interesting to make you stop. So I think everybody will appreciate having you for an extra 5 minutes to listen to what you were saying. And thank you too for inviting you into your hotel room. It's lovely.
It's something.
So lots of information there, and really interesting to hear the results of the APF patient survey that you talked about, and really interesting to hear about respiratory medicine in Scotland and the respiratory care action plan. So yes, any questions at all, any thoughts, if you could put them into the Q&A, please, and we will answer as many as we can at the end. Our next two speakers are two ladies that I have had the privilege to get to know quite well over the past few months, and whose roles are invaluable in supporting those living with pulmonary fibrosis. Michelle Duffy is an advanced practice respiratory nurse based in the community respiratory team in NHS Highland. She's the current chair of the Scottish Respiratory Nurse Forum and a member of the cross-party lung health group. She's been a Queen's nurse since 2017, which has made her focus on discovering the things that help keep people well. Michelle says she's lucky to work with a team who value shared learning, and she's able to facilitate this locally through ECHO, where the ethos is about sharing specialist knowledge and general practice, and nationally through the nurse forums. And we also have Susan McCluskey, an ILD specialist nurse working within NHS Greater Glasgow and Clyde. Susan qualified as a nurse in 1992, joining the respiratory nurse specialist team in 2007. In 2014, she became an ILD specialist nurse, the first NHS funded post of its kind in Scotland. Today, Michelle and Susan are going to talk to us about their roles in two very different areas of Scotland. So a warm welcome to Susan and Michelle, who I hope are there somewhere.
Hello, thank you very much, Alison, for your warm welcome and inviting both Michelle and I to talk today. So I am the interstitial lung disease nurse specialist in lovely Glasgow. So NHS Greater Glasgow and Clyde is actually the largest health board in Scotland. We cover a population of approximately 1.2 million people. And this, the health board covers 6 local authorities areas, and we have 5 acute hospitals and 3 ambulatory care hospitals within the health board. Our ILD service in Glasgow has a combination of there's 5 consultants who specialise in interstitial lung disease and have specific ILD clinics across the city. We have about 15 MDT meetings per year. So our MDT meeting, which is your multidisciplinary team meeting, that's when a combination of the specialist doctors, nurses and specialist radiologists come together to discuss cases, to confirm diagnosis. But we also use our MDT meeting to approve patients for antifibrotics. And over the last 8 years, we've probably approved over 1,000 patients through the meeting for antifibrotic therapy. There is just myself as the nurse specialist, although we do have a larger team of respiratory nurse specialists across the city who help as a wider group. We're very fortunate we also, over the last 3 years, have a specialist pharmacist And the specialist pharmacist works jointly with myself to help monitor and support patients who are on antifibrotics. We currently have over 240 patients within the city that we support on antifibrotics. We also run a support group, the West of Scotland ILD support group. This support group's been running for 10 years. And then when COVID hit, we unfortunately had to suspend it. But we're very grateful that we've managed to start the group back up this year as a virtual group with the fantastic support of Alison and Action for Pulmonary Fibrosis. We also have a pulmonary rehabilitation service who, prior to COVID, we had specific interstitial lung disease pulmonary rehabilitation. The team have worked very hard during COVID to help to support home exercise programs, and we've now got the groups back up running again. In terms of my role, I was appointed as a ILD clinical nurse specialist back in 2014. And as Alison said, it was the first NHS funded post in Scotland. My remit is Glasgow wide, so I don't cover Clyde, but it means that I am, so it's quite a large remit, and it means that I am shared between 4 consultants across the city. And in terms of practical day-to-day, week, I probably visit 4 different hospital sites per week. I'm just going to pass you on to Michelle, because just to see, you know, Michelle stays in Highlands and works in Highlands, and just to see the difference for within her area.
Thanks, Susan. So I have to confess, I am certainly not an ILD specialist nurse. We care for IPF amongst our normal work as our respiratory nurse specialist team, and I suppose you just to contrast and compare the 2 areas, it's just incredible. When I've been speaking to Susan over this last weeks, the workload that goes on in Glasgow is just enormous. However, I think that what we what we do understand is, and I think Tom said this as well, whether you live in Drumchapel and you have been just given that IPF diagnosis, or you live in Achill-to-Buie, the same feelings are going to be there, and the same challenge as well. So certainly we cover that huge area in Highland. You can see that kind of horrible mustard colour up the top there. It's an enormous area. And we have nothing like the amount of patients and work that you have there in Glasgow. But we have that aim to provide the same standard of care wherever that person might be. And so how do we do that then in areas? And I suppose largely across Scotland, most areas you'll identify with this, there's that degree of remoteness and rurality wherever you are out with, as soon as we leave the Central Belt. So there's a beautiful picture here. It's just an excuse to show nice pictures. That Glasgow one that Susan showed is lovely as well. So this is up in Assynt, and I suppose down every single glen that we can see in that picture, although we're saying it's still a fairly unusual diagnosis, there are people we know up each of these glens. So how do we provide that care? How do we make the care accessible? And I think it's fair to say that probably where your work there, Susan, has taken place over the years in Glasgow, we've kind of followed, and we still with pride, and we still the setup of your clinic and that MD team, multidisciplinary team, which is just so crucial in providing the care. So we still that, but how do we do that? So the picture down in the bottom hand corner here is the Berrydale Braes coming down from Caithness. And actually there are worse roads in Scotland, I'm sure there are. But for people to access care we've got our one district general hospital, this is Regmore. So for people to access care from Caithness to Regmore, that's going to be about a 6-hour round trip with really quite bad roads. So you can imagine then you have to set up at 5 in the morning, you're not home till 8 at night. Before our ILD clinics, which have been running now for 2 years or so, before that, people were doing that numerous times, back and forth, because we were doing it in not quite a coordinated manner. So things have improved greatly, and yet we've stolen a lot from that best practice. So I think things are getting much better, but it remains a challenge, and I suspect the challenge we have in Highlands will be recognised in most of the areas. Thanks, Susan.
In terms of, how do patients come to our clinics? Patients can get referred in from various sources. Some of them will have gone to their GP first of all, or sometimes we get patients who have maybe been admitted into hospital where they have been diagnosed with pulmonary fibrosis, and sometimes we get patients sent into us for perhaps other specialities where they've maybe had a scan for another reason, and it's picked up pulmonary fibrosis. With the vetting system in Glasgow, a lot of the patients, if they're referred in from the GP, often will have their diagnostic investigations before they actually get seen at our clinic. So that may be having a CT scan or even lung function tests. If they have a specialist interstitial lung disease clinic within their area, then majority of patients will get directly referred into the specialist clinic where they're seeing a doctor who specialises in interstitial lung disease. From the specialist clinic, then then they can get referred into our MDT if that's required for confirmation of diagnosis or approval for treatments. But every patient who gets diagnosed with pulmonary fibrosis will get follow-up. I don't know if that's very similar for you, Michelle, in the Highlands.
It is, and it's a fairly new thing. As I say, it was the case so that people would sometimes be picked up really quite late, because I suppose it is quite a rare condition still, thankfully, and it might be in the rural practices that GPs are not seeing, so the awareness is not there that actually this might be a diagnosis. So people were probably quite late. Now I think the awareness is much higher, and having that dedicated ILD clinic with the MDT team has made a huge difference. I think it's not perfect, and there's a long way to go in terms of care provision, but yeah, it's similar now, Susan.
And Michelle, what do you find is maybe your biggest challenge for patients within your area, or you find the biggest challenge perhaps doing this role?
So I think that's a really good question, Susan, and it very much goes back to what Maureen said in the first section here. You remember we showed that picture of Lochinver and the long roads, and it strikes me, and we hear the story time and time again, that we do our best in clinic, but people after that diagnosis have got a long way then to travel between the hospital and home. And if they've had a wee Google search as they're leaving the hospital, the word that comes up time and time again is that they feel abandoned. And that's just a common word that they say, and that's with the best will in the world from our healthcare team. And often then the follow-up is not for maybe 3 months down the line. And so I think that's an enormous challenge, and often we have to then go in and unpick some of the things that people have found. So I think that's a huge challenge for us. Is just there's not enough resource then.
Yeah, and I think the thing is to say, certainly since I've been in post in 2014, and I don't know if you'll feel the same, Michelle, that things have definitely, there's been positive improvements. We now have antifibrotic medication, not just for patients with idiopathic pulmonary fibrosis, but for other types of progressive pulmonary fibrosis. There's a lot more kind of support groups within Scotland as well to provide peer support, which is so valuable. Since I was in post in 2014, there's more nurses now who are either specialising in interstitial lung disease or have incorporated pulmonary fibrosis or interstitial lung disease as part of their wider respiratory nurse remit. In the past, again, pulmonary rehabilitation, the outlook in that originally it was just for patients with COPD, but we know now how beneficial that can be for patients with other respiratory conditions. Within Scotland, there are clinical trials taking place. We have got really strong links with the team through in Edinburgh, where that we're able to refer patients through to see if they're suitable for clinical trials. And certainly it's really promising, in the future, in terms of medication and things like that. There may be things in the future that can help to further slow down this disease or even stabilise it. And we're very grateful for I think the input from her charity partners, Action for Pulmonary Fibrosis, Chest, Heart and Stroke Scotland and the British Lung Foundation have all been fantastic in supporting patients with this disease, as well as raising awareness within the general population. I don't know. Another thing is just to say, even, Dawn spoke earlier about, oxygen, the equipment for oxygen and the oxygen service in Scotland is fantastic. And there's always more equipment and better devices, coming along. So I think the future is positive, as Dawn says, for improving support and care for patients with pulmonary fibrosis.
Do you know, it was brilliant to hear Don talk about his the turning point in when he went to pulmonary rehabilitation, and that seemed to be just the thing, that it was a game changer. And I think when we look back, when I think of when I first came across this condition, it was a bit hopeless, and none of us really knew what would make it better. But I think over that last 10 years, as you say, Susan, I mean, the medications, the antifibrotics, what a game changer that is. And that just gives us so much hope for the future. The softening of boundaries, as you say, around pulmonary rehabilitation, although with the proviso that so many people who would benefit from it don't have access or can't have access to it. So I think we need to have that proviso in. But actually, so you would just want to discourage people from looking at that Google top line and getting access immediately to good support and information from a body like Action Pulmonary Fibrosis immediately at post-diagnosis. And I think, I just wanted to finish on this slide because I really do think it is a message of hope then for the future. And this was the Cambridge Dictionary. It said to want something to happen or be true and have a good reason to think that it might. And I think, Susan, what your slide just there showed is that we do have good reason to think that is possible. So yeah, onwards and upwards.
Thank you. So thank you very much. And if anyone has any question for us, we'll be very happy to answer that in the panel discussion.
Great. Well, thank you very much indeed, Michelle and Susan. That was absolutely brilliant. I really liked your ending on hope, the hope that antifibrotics now, but future antifibrotics as well. We're on a roll with IPF and PF research, and let's hope the future is a lot brighter for people with the disease. That's really great. So if all the other panelists would like to join and switch on their cameras, we've got about 15 minutes or so of questions. I don't know. Is Tom here? Not sure. Let's see. Okay. Well, while we wait for Tom to join, can I put one back to you, Michelle and Susan? There are some. Oh, here's Tom now. Great. Okay. Well, hi. Tom, go first. We've been receiving emails and WhatsApps, as well as the messages online. I have one for you if you're ready, Tom.
Yeah.
Yeah, okay, fine. It is about you said a couple of points that somebody says IPF is a very rare disease.
Yep.
Is that actually correct? Because the figures that published by epidemiologists out of Nottingham reckon it's 32,500 in the UK, which is 1 in 2,000 people, which is actually the borderline between rare and non-rare. So it's not very rare. And if you think of the other progressive pulmonary fibrosis cases, HP, CHP, hypersensitive pneumonitis, rheumatoid arthritis, ILD, which, if they become fibrotic, end up in a very similar experience for patients as IPF. Those last few years are very similar. I mean, we have something which is actually an uncommon disease rather than the rare disease. And I wondered what your view, somebody's put that question. I wonder what your view would be on that.
I mean, the definitions of what is rare and what's not are just numbers that people have plucked up out of the air. But it's not asthma, is my point.
Yeah, that's true.
It's not asthma, COPD, which are hugely common. In Tayside, population 250,000 people, we have 35,000 people with asthma. And that's just in Tayside. So that, whereas in terms of IPF, we've got a couple of hundred tops. So it is rare. I mean, I suppose my question back is, why is that important, and what are they trying to drive at? Is it because
I think what patients feel that is it's a disease that you invariably die from. Which you die from quite quickly. The other diseases you mentioned, either you don't, thankfully, generally die from. They can be very unpleasant for very large parts of your life. And in the case of COPD, it's a much longer gestation than it is for IPF. So I think people feel, actually, this is serious for all of us, and we want more recognition.
You mustn't conflate seriousness with frequency. I'm not saying it's not serious. Of course, it's very serious. But the problem is that an average GP practice will have 1 patient with IPF, perhaps 2. So you can see from that sense it is rare, because your average GP is not going to see a lot of IPF. A practice may have a bunch, but a single GP is not likely to see very many. And we have this issue with lots of other rare diseases, cystic fibrosis. Where there are 600 people in Scotland with CF, and to me, it's not rare at all. I'd run the CF service, but a GP may never see a patient with cystic fibrosis their entire career. Right, but that is clearly a serious disease. So I'm not saying it's not serious, but far from it. It's a very serious disease. But I think the challenge is, as Michelle has just said, is that awareness of it is challenging when a GP or a practice nurse may have never seen a case of it before.
Great, thanks for answering that, Tom. On to Susan and Michelle. Some practical questions for you. Okay. Do you see people in their homes or in the clinic? If you see them mainly in their clinic, what happens when?
Sorry, on you go.
Go on, Susan. Yeah.
No, I'm sorry. What was the second part of your?
Oh, it's just that if it's mainly in the clinic, as people deteriorate, who looks after them at home?
Okay, so I do a combination of all of that. So majority of my work is done in clinic and in hospital, but I also do go out to see patients within the community. Obviously, I'm not able to see every patient who has pulmonary fibrosis at home. So I'm very grateful to have links with the kind of general respiratory nurses. Historically, it was that patients used to get input from nurses, the respiratory nurses at home once they went on oxygen therapy. However, we now know that if someone's needing support who's not on oxygen therapy, then we can either bring them up to clinic or I can see them at home. I don't know if that's the same for you, Michelle.
Well, it's different in that we don't have IU, Susan. We don't have an ILD nurse, and so we probably incorporate a lot of that into our normal caseload. And I think exactly like yourself, we use what resources are there, and in every area in Highland certainly, so I suppose across Scotland is different. So we're able to utilise Macmillan support often. or the community nurses, but it's dependent on area and the resource that is in that area. So, but certainly we do aim to provide support at home. Often, now this might be controversial, but often we are able to use much more in the way of near me or attend anywhere it might be in other areas. So we can facilitate that. So for instance, we can have myself seeing someone at home where we can be connecting back to Regmore to one of the consultants, to the physiotherapist, and have that multidisciplinary meeting with the person in their home. And I think in the future, we'll try and do much more of that.
Great. And how do patients get referred for pulmonary rehab? Is that for the clinician at the hospital, or is it the GP? How do people generally get referred?
So in Glasgow, the majority of patients will get referred through secondary care. So that's either through their consultant or through their respiratory nurse. GPs can also refer in to pulmonary rehabilitation, but historically that's been more for patients with COPD. But yeah, and I think that's similar with yourself, Michelle, is it?
It is, but we need to blur these boundaries much more, because I think even for our COPD patients, lots of them don't access or are not referred to pulmonary rehab, and the awareness then that actually this is one of the most helpful interventions in IPF needs to be much more. So I don't think it would be the top of a GP's head. So we need to be raising awareness of. I mean, Dawn, if we could just get Dawn to do a video, that would be fantastic.
Yeah, this is a problem all over the UK, actually, isn't it? So, and it's great that I know, Susan, you were one of the few places in the UK that had dedicated only pulmonary fibrosis PR courses in the past.
Yeah, so we set up a couple of classes a week, and it was just dedicated for patients with interstitial lung disease, and it meant that you know, the exercise component was very similar to a traditional pulmonary rehab class, but it meant the education was more specific for patients with pulmonary fibrosis.
Great, thanks. Alison, could I turn to you and just say there must have been, I don't know whether there still are there, a dozen questions in there about support groups, one thing in their areas, and a very interesting one, which is something which does happen with some other parts of the UK, of carers groups, running by Zoom meetings, running face to face. Can you just give us a summary on where we are and what your hopes and plans are with support groups in Scotland?
Absolutely, we are moving forward with support groups in Scotland. I'm glad to say we have. I think I mentioned when I talked. We've currently got groups in Lanarkshire, Fife and Tayside, Glasgow and Clyde, Forth Valley. We had a group up in Aberdeen that stopped just because COVID started and they didn't meet online. So they're going to be getting up and running again. Working with NHS Highland and Michelle, we've got a meeting next month to look at getting an online group going up in Highland, because obviously that works best up there online. And as I say, it's great having these other platforms that we can utilise for people who aren't able to travel, who still want to be part of a group. So we can use Zoom and Teams and things to actually allow people to meet. And somebody I noticed put a question in, and I did answer it to say, do I have to go to my closest group, or if I can travel, can I go to another group? And you'll be welcome to go along to any group that you want to, and you can join any group virtually that you want to. I think I said, I answered a few, and I said my email address, which you can get from our website, but it's alison@actionpf.org. If you want any more information about the support groups, then please either look at the website or drop me an email. I am working with the different health boards and the respiratory teams in different areas to get groups up and running, and it's great if we can get groups started that don't have much input from the respiratory teams, but it's better if we do have input from the respiratory teams, because then they know that referrals will come to that group and more people will know about it. So if we can have that buy-in from the respiratory teams, that's great. So if there's any respiratory nurses, consultants, pharmacists, anything out there listening who thinks I would love a group in our area, then let me do the hard work for you. And please do get in contact with me, and we can look at the best way to get a group started, because what we want to do is get these groups covering as much of Scotland as we possibly can. And as Maureen and Dawn testified to earlier, they get so much from the peer support in so many ways, not just the support, but information as well. So we really want to get these groups up and running. So any questions at all, please fire them my way. I can keep everybody up to date on where we are. If you want to get a group started in your area, absolutely wonderful. Please do get in touch with me. I'm only too happy to help you get a group started. But yes, we are getting there. We are moving forward. And one of my aspirations as we go forward is to get more groups set up, and as many as we possibly can. I hope that answers your question.
It does very fully, thank you. And another related question, Tom mentioned the issue of awareness. I mean, that's both awareness of the general public, awareness of IPF patients or PF patients and their families, but also awareness of healthcare professionals. And the question in the chat is, in the Q&A section rather, is what's APF doing to educate healthcare professionals about the disease, to help people who don't know about it learn more what they need to know about interstitial lung disease and especially progressive pulmonary fibrosis?
Yeah, well, we do our best to keep health. I mean, obviously, you know, everybody, it's as you see, said, it's a disease that it is relatively rare. So it's about educating people and letting people know about it, the general public and healthcare professionals who are expected to know about a myriad of different diseases. And we come in and say pulmonary fibrosis is so important. You need to know all about it because it is important, and it's important to us and people that are living with it. So we do try to. So I work with the respiratory teams who already know about it, but it's about I think a general education too, because I think we hear about people going into hospital. I mean, it's a general hospital and they're in a ward that's not necessarily a respiratory ward. We get feedback that the staff on there didn't know about pulmonary fibrosis. So we do try to keep people up to date with it. We offer education sessions to the healthcare professionals so they do know about it. We have a GP learning module that was set up along with the Royal College of General Practitioners, which means that GPs can go on to that module and learn all about pulmonary fibrosis. We also, there's I think I mentioned it to you, Maureen, in the chat, because I can't remember what it's called, but there's a sort of patient network. It's run in Lothian. But patients can go from anywhere to it, and it's where we are training our up-and-coming doctors. So you become part of this. You go along as a patient with pulmonary fibrosis, and these doctors in training have to then listen to what you're saying, and they have to then present what they think the diagnosis is, but by listening to what your symptoms are. So they get an education about what pulmonary fibrosis is, and it means that our new up-and-coming doctors are learning about pulmonary fibrosis when they're just going through their training as well. And we can go along to meetings. In fact, my colleague Andy was at a respiratory nurse forum, I think, in Basingstoke. He's on his way back today, and hope he's listening to this. But he was there. So it's all about educating the nurses as well about pulmonary fibrosis. And I think it's just the more we talk about it, and the more we talk about it outside, and the more we can network with healthcare professionals across Scotland and across the UK, really in general, the more people will get to know about it. And it's about asking questions too.
Great. Well, one other thing I'd add to that is that we have worked with the Royal College of General Practitioners to develop a learning module for GPs. Any GPs in the country, healthcare professionals too, can log on, contact us if you have any problems. It's a 1-hour training on all you need to know about diagnosis and treatment of idiopathic pulmonary fibrosis. And it's proving very popular. You know, part of your professional points every year that you have to collect, you can do them that way through the Royal College of General Practitioners. So it's great. Tom, another one. The question about clinical trials in Scotland is, I mean, it certainly is an issue in pulmonary fibrosis. We recently did a study across the UK and found the only hospital really in Scotland that was consistently being involved in clinical trials by major pharma companies was Edinburgh. We got very little elsewhere in pulmonary fibrosis. Is that true of other diseases as well, or other respiratory diseases, or is this a problem we have to address in a wider way? Sorry, you're on mute, Tom. Sorry. Yeah.
It's the same for pretty much everything, to be honest. Developing a robust research network in Scotland is very challenging. Everywhere is a small hospital, apart from the couple of very big hospitals, and it's a question of if it's the same amount of overhead in terms of paperwork, good clinical practice, bits and pieces, governance work to recruit one patient into a study as it is to recruit 100. So because if you Regmore, let's pick Regmore as a hospital, you might have 150 people on your books with IPF, of which how many could enter a trial? if they fill the criteria, maybe 1 or 2, then you need to it's a huge amount of work to enroll in that study as a centre, to enroll perhaps 1 patient. I did a CF trial a couple of years ago, and we didn't enroll anybody because nobody was eligible. So it's a big ask, and that is just one of our geographical challenges. There are efforts to try to make Scotland a sort of a 1 unit, rather, so we don't have to apply 6 or 7 different places. Just make Scotland a clinical research centre. That is definitely above my pay grade. But it's not just IPF. Recruiting people, I think the only area in which Scotland performs well in terms of consistent output of research is asthma, because it's so common.
Yeah. Well, that's as it should be. Yeah, that's really encouraging, though. I mean, I think we feel the need throughout the UK to start a dialogue between clinicians, patients and carers and pharma companies. There's something wrong with the system at the moment. We're not getting enough patients being recruited for a large number of trials that are coming up. Very difficult to recruit patients. The number of trials nationally have gone down 1/3 since perhaps Brexit, I don't know if that's the reason, but we're certainly leaving having a separate authority from the EMA. There's lots and lots of issues that we really need to be addressing. But thanks for that, Tom. Yeah. So Don and Maureen, no specific question, but seeing all the questions in the chat and hearing the talks today, do you have any final thought to leave us with?
Well, one of the big things that's coming to me just now is that people talking about how common or uncommon pulmonary fibrosis is. If you're a patient like myself, it is the most common thing in the world. So it does and can be the centre of your world. And I think you have to work with the support you get from places like APF, the likes of Susan and so forth, at the respiratory department, so it isn't the centre of your life. And it is part of your life.
That's brilliantly put. That in lots of disease areas, they always talk about, don't use the word patients, they talk about living with the disease, right? And we do that in APF, but having been a patient myself, I have no problem in calling myself a patient. No, it took over my life from the time I was diagnosed for 8 years. And even though, my transplant I'm living with the problems of now, the benefits as well, but is down to IPF. So come on, for us, we're patients. Interesting. Maureen, what about you?
Just echo what Don said, but one thing I found today, I'm not surprised at the lack of knowledge about pulmonary rehab. Many of our members come to our groups, they've never heard of it, they can't get access to it. And I think that needs to be built up, and so that more people can gain, because I've seen so many people with PF who have managed to stay healthy for many more years, just by exercising and attending pulmonary fibrosis. Sorry, not pulmonary fibrosis, pulmonary rehabilitation.
Yeah, and I think you when you spoke earlier, mentioned the elephant in the room, which is psychological care, psychological support, the mental health of patients, something which we don't do well across the UK. And we really need to do better for pulmonary fibrosis patients. If we were cancer patients, we'd probably get better care than we do as PF patients in that respect. But bring it to a close now then. Alison, a quick one for you. You're here now. You've been with us, thankfully, for at least a year, I think now, doing a brilliant job. If you look forward 3 years from now, and we ran another event like this, how would things be different in Scotland?
Oh gosh, that's a loaded question, I think, Steve, there, isn't it? How would things be different in Scotland? How would I like things to be different in Scotland? I think I'd love to see an expansion of our groups. I think I've said that, and I think we all feel that expansion of our groups across Scotland, so as everyone who has pulmonary fibrosis has access to either an online group or a face-to-face group in their area, and they feel that they can get the support from that. I'd love to be in discussion with respiratory teams in every health board in Scotland, right across the country, talking about how we can develop our services and how we can reach more people earlier in the journey following a PF diagnosis. And I think really I want more people in Scotland to know about and better understand pulmonary fibrosis, so that for anyone affected by PF in Scotland to know that they can come to APF for support, for guidance and for advice.
Yeah, remember that APF is always here for you. That's great.
Absolutely.
I mean, I've attended a couple of international conferences recently, And I've come away buzzing for the first time in my 14 years since I first heard the words pulmonary fibrosis, buzzing at the optimism in the research community about what can be done about progressive pulmonary fibrosis. People talking now about, within 5 years, possibly being able to stop the progression of the disease. As you can with HIV/AIDS, antiretrovirals actually stop it. They don't cure it, but they stop you progressing. And the idea that we may well, with all of the new antifibrotics coming up, going through trials at the moment, we may well end up in a really positive place. And there was another question that we received by email about whether stem cell therapy has anything for pulmonary fibrosis. And I think it's early days yet, but we are optimistic also about that. The same doctors, same researchers were saying, and give us another 10 years, and we might crack the whole question of lung regeneration and actually curing this disease. So this isn't optimism for next year or for the next 3 years. It's slightly longer term than that. But I always think that if my children were to inherit from me whatever gave me IPF, I hope very much the world will be a different place for them when they come to it. So thank you all very much. Thanks to all our speakers today, to Tom, especially for interrupting the time with the at the British Thoracic Society winter meeting, to Michelle and Susan, to Don and Maureen, and to Alison, who has been an incredible, I think you've got a job waiting for you in television, Alison, you're so good at it, which is great. And just to say, we hope very much from APF that this will be another step towards building a strong and effective pulmonary fibrosis community in Scotland, involving patients, carers, HCPs, healthcare professionals, and researchers all working together. And let's really generate that powerful patient voice that hopefully will bring about change and improve the lives of people living with this devastating disease. So thank you all very much for joining us today. Thank you again to our speakers. It's been a wonderful time. I hope you have a good day. Thank you.